Hi, I'm Dr. William Starsiak, owner of and physician at the Starsiak Osteopathic Clinic. And in this video, I'm going to discuss the distinction between direct and indirect treatments when it comes to osteopathic manipulative medicine. Now, these are distinctions that I learned through osteopathic school, but they are applicable to any approach to treating the body structurally. Now, this concept begins with awareness of a joint's range of motion. So every joint has a normal physiologic range of motion. And then there is a midpoint between the two extremes of motion. So let's imagine this is a vertebral segment. And this is the spinous process, the bump that we can feel in our back. If this person's head is that way, their feet are that way, then as I do this is like the segment rotating to the right. This is like the segment rotating to the left. And then this is the neutral position. Now, there's the physiologic barrier that the patient can move to under their own effort. And then if someone takes an external force and twists them further, they can go further and approach the anatomic barrier, which is where if you went any further, damage would occur. There'd be ligamentous damage or even fracture, depending on how much force was used. Now, this neutral position, in this case of the vertebra, but this applies to any bone in relationship to any other bone, this neutral position is determined by the summation of the tension on all of the ligaments attaching to this bone, all of the fascia, the connective tissue that is in these sheets that runs everywhere in the body and connects everything together, the summation of those tensions, and muscular tension placed upon this. So when all of those are well balanced, the neutral is at midline. But different things can bring that neutral off of midline. So that now, in this case, the person would be, their segment would be starting preferring to rotate to the left. So then their neutral would be here, and they wouldn't go equally as far to the right as they could go to the left. They can now turn to the right less than they can turn to the left. This sort of change doesn't happen in a single segment. It happens throughout the whole body. Any injury that occurs, the whole body is subject to that injury. So this, we may be able to check a single segment and find that this one segment prefers to go here, but it's in relationship to everything else. The ligaments will transfer tension from the other bones they attach to. Muscles transfer tension from the other bones they attach to as well. Fascia will transmit tension from everywhere in the body to everywhere else in the body. So within osteopathy, we recognize that we need to consider an individual part of the body in context of the whole. That we can't just say, okay, we got to fix this thing's off. We need to find out, well, okay, how does this thing being off relate to the other things that I found different in the body? And what is the causative area? What is the sort of fulcrum around which all of this stuff is stuck? And going to that point of the fulcrum and addressing that. And so anyways, we have this concept of a neutral point and normal physiologic ends. So like an original neutral, and then a pathologic neutral after some sort of repetitive motion injury, where someone like a dentist who's always turned over one way, then it's going to be easier for them to turn that way. And it's going to be harder to go that way. So they're likely going to develop pain in the right side as it's trying to pull them back up the other way. Or a saxophonist who's, getting pulled down this way by the saxophone. So they may get pain in the lower left side and have ease of motion to that direction. This applies for any sport. A golfer, they're swinging to the left, so they're going to have ease of motion into that. Same thing with a baseball player. Pitcher is asymmetrical. Bowling is asymmetrical. So repetitive asymmetrical motions will create this change from a neutral balance point to a compensated balance point. And a change one place will then require other places to change with it. So if low down I'm side bent left, up high I'm going to have to be side bent right somewhere to make up for it. A degree of this is normal. All of us have this to a certain degree. It's when it becomes very pronounced and restricted, when it's not wiggling in that position. That's when it becomes a problem. Trauma can also create this. The worse the trauma, the more it will get the area stuck. So falls on the tailbone. I see this all the time. A fall on the tailbone will jam up the lumbar spine, and then 20 years later, someone comes in with back pain. Back pain started when they were in their teens or 20s because they jammed up their spine when they were young. Back pain starts when they're young, and then it progressively gets worse, and they're the ones who end up bulging discs or herniating discs, and they never connect those injuries when they were a child. It's just like you hit your car in a pothole, the car becomes misaligned, and then the tires start to wear funny over time. These traumas set up changes in that balance of tension that then lead to wearing of joint surfaces early, poorer lymphatic drainage that leads to increased inflammation in the area, that leads to changes, osteoarthritic changes, poorer neural flow going outward that can affect muscle tension. It can affect organ function as well. Venous drainage can be impaired, which will worsen lymphatic congestion. Arterial blood flow in can be slightly impaired, which can make the muscles more susceptible to fatigue. So it's very important to address these changes when they happen. And this brings us to, well, how do we address them? And that's where these two distinctions arise: direct and indirect treatment. Most of the stuff that's out there outside of osteopathy is direct treatment, which says this: you have this going on, we're going to do something to directly make it go back here. We're going to try to force that neutral balance point to return to its correct neutral balance point. So maybe we'll take it over here and we'll hold it and try to get the tissues pulling it this way to relax. Or maybe we'll try to treat a joint surface and we'll kind of move it in a particular way and then thrust it through so that the adhesion in the synovium of the joint surface is no longer a piece. And then hopefully it stays back at neutral. So that anything where the practitioner is directly moving the restricted element through, their force is directed to move it through the barrier, that's a direct technique. An indirect technique is the opposite, where if this is the new neutral, and then the tissues on this side are kind of trying to pull it back towards the normal position, but they can't because it's stuck. There's a tug of war going on. And so if we try to push it back frequently, it will keep going back here. Even if we thrust it, it'll be better for a bit. But then when they move around, because it's not just this segment, it's the whole body, it'll pull back this way again. So an indirect technique says, all right, let's accept it how it is. It's over here. And let's bring it right to balance, just exactly where it wants to be, so that it's in this spot that it comes to rest. All of the tension is balanced. There's no more tug of war. It's like if you had a surface that had a little hole in the middle and there was a decline down to that hole, and you had a ball and you're rolling this ball around, it'll just settle into that hole. And if you try to move it out, it'll want to settle back into it. That's how it feels when we get it to that position of balance. And then we can provide an activating force like a compression or a traction, or use the patient's respiration, or even with following the patient's cranial rhythm, which many listeners may not be familiar with the cranial rhythm. In another video, I will discuss that and explain that. So check back for that one if it's not up yet. But those all can serve as activating forces to then as this is in this position and it's balanced, it'll just start relaxing, 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 and then release and move back towards neutral. It's like if you have a friend that got dumped. If it wasn't that long of a relationship, they weren't that attached, then it will be easy for them to get over it. You could probably just distract them and they'll forget about the person. That's like a direct technique. But if they were really attached to that person and they were not ready for the relationship to be over, then you're not going to be able to distract them. That will only make their suffering last longer. The best thing a friend can do in that setting is to actually sit down and listen to them, to let that friend express their emotions, to get them balanced in their feeling, to steer them away from hopelessness, steer them away from despair or depression, but just kind of help them feel their feelings without getting stuck. And then they'll eventually let go on their own, and they will get back into relationships without someone trying to make them or distract them or encourage them. They'll return to their sort of natural thing. Now, this is a very simple example, but the body is very complex. All sorts of things can affect all sorts of other things. Maybe something jammed up in my wrist is restricting my elbow, which is restricting my shoulder, and it's pulling on the base of my head, and it's giving me pain in my neck. So the neck won't get better until the wrist is unjammed. So people will go get their neck popped, or they'll get massage. And it will be better for a day or for 2 days, but it comes right back again and again and again. It's because the true source of it's not being addressed. So that's why, these distinctions are really important to know. I'm trained in both direct and indirect approaches. I mostly use indirect approaches, and if I'm getting stuck with those, then I will move into direct. Indirect is as a rule painless. Sometimes you get some mild soreness. You can get some post-treatment soreness, but during it, it's painless. It's actually finding these positions of ease that are very comfortable and relaxing. So direct techniques can be uncomfortable, especially direct myofascial release. But both approaches require considering the whole body and then working in layers. So usually something that's bad enough to get someone in my office, we need a few treatments, and we see that we do a few treatments close together, like a week apart. As soon as their problem is gone and doesn't come back over the course of a week, we jump them out to a month, in some cases maybe just 2 weeks, and then we keep them at a month until the symptom doesn't return over a month. And then people are usually pretty good to go for a while. And depending on how severe it is, if there are surgical or anatomical changes, they may need some ongoing maintenance. But as a general rule in osteopathy, the need for intervention in the vast majority of patients decreases over time. If you've addressed everything and you've stuck with it in the beginning and it's gotten stabilized, you need less and less and less. In the beginning, you need a good amount, but then gradually you need less and less and less. It's not the sort of thing where it's like every week or every 2 weeks or every month over and over and over for the rest of your life. And the closer you come in to the time of the injury, the less you wait before coming in, the easier it is to get it taken care of. And the more suffering and pain you can prevent yourself. So this is great for kids, because if your kid gets injured, they sprain their ankle, you don't want them to wait until they're 40 years old and they're having bad back pain associated with a really bad ankle sprain. Get that ankle treated right away and they won't have to deal with it. Or hard falls on the tailbone, hard hits to the head, anything where the wind gets knocked out of someone, any sort of surgeries. All of those traumas, they need to be released from the fascia so that the body isn't restricted while you're going through your life, because then that's going to lead to problems down the road, even if you're not noticing them at the time. So please, if you think this could apply to you and you're interested in availing yourself of osteopathic medicine, give me a call, 317-410-9978, or text me at that same number. You can email me with questions, info@drstarsik.com. You can check out my website, www.drstarsik.com. You can also subscribe to my channel. There should be a link here on the screen, and you can check out my other videos. There should be a link over here on the screen. So thank you very much for your time, and I hope you have a wonderful day.